And that is something to keep an eye on. So you might ask, why is this happening now? Well, putting together information and thoughts from the CDC as well as from locally, our local health departments, and then talking to the people who do the boots on the ground, the people who know, because they're looking cases up every day and talking to people, and that's our contact tracers, both from the local health department but also from our workplaces here in the county. And there's three things that pop up. One of which is still household-based social gatherings, and I've been talking about this since all summer. But in the summer we talked about the beach vacation or going up in the mountains and renting big houses and having family get-togethers and friend get-togethers. I think now it's become a little bit smaller, but it's still get-togethers that are occurring at a household level. So, hey, let's get together on Sunday afternoon and watch football together. Or, we're going to have a birthday party on Saturday, and why don't we get a bunch of families together for that, either for kids or for adults. Or, my kids are really getting bored. Let's have a sleepover with friends, and things like that. So it's these smaller get-togethers, and they seem innocuous. You ask somebody, it's like, hey, I'm not having a big rally, or I'm not going to a huge football game or hanging out with crowds. It's just friends. But again, and I've been talking about it all along, anytime there's opportunities for two bubbles to come together, COVID could be hiding in one of those bubbles, and it's a chance for exposure. So that's occurring, and infections are occurring that way. The second thing is workplace, and again, it's not the actual doing the work at the workplace. So it's not working on the machine, or it's not in the meetings, or it's not taking care of the patients. It's breaks and lunches where people get together and they drop their masks. And it was in the paper and on the news, and including with my friends here from WXII this past weekend, about a cluster of cases occurring at our courthouse through the bailiffs. And it wasn't really any gross negligence on anyone's part. It's just bailiffs got together and they eat together and take breaks together. And masks come down during the process of eating. So we all have to be more vigilant about how we approach things in the workplace, because it's the things that you don't think about. And I would not focus on any one workplace as being a problem or singling them out and wagging a finger at them, because every single workplace in this state will eventually, by the time this pandemic ends, have some cases in it, and quarantine might be necessary if you're not distanced and you've had contact with that person for more than 15 minutes. So no one should feel shameful that it happens, but we just have to keep our vigilance up in the household and in the workplace. The last place where I think we're starting to see some cases are connected to our more recent openings of the state, particularly some restaurants and drinking establishments. And we've talked about that for a while. I don't know of any fitness center related outbreaks in our area. However, I will tell you that there have been several reported in the last 2 weeks across the states and in Canada, including large outbreaks related to aerobic exercise facilities, including spinning classes. And one up in Canada now is up one place in Toronto, a spinning class, 170 people now infected, more quarantined, and I think that number will go up if you look at secondary cases. So we really, really have to be paying attention in places where the indoor places for exercise and in drinking establishments. And according to the North Carolina governor's edicts, that's not the right word, but I'm blocking on the right word right now. People aren't supposed to be indoors and at drinking establishments, other than just to go in and get the drink and then scoot out. So I would keep an eye on that. A few other things that I'll take advantage of the news this week to talk about and remind people of. Duration of isolation. How long is a person really infectious? President Trump's in the White House situation brought this out in the news a little bit, and there was a lot of back and forth. Is Trump still infectious or is he not? So it depends a little bit. So 99% of people are done shedding virus by day 10 who have mild to moderate COVID. People who have severe COVID occasionally can shed it for as long as 20 days. What is severe COVID? Most of us in the infectious disease world think of it as somebody who's admitted to the ICU with it, or somebody who's got an immunocompromising condition, transplant, cancer, or something like that, that they're getting chemo for. So for most people, it's 10 days. Where did President Trump fit in that? Well, it's a little unclear because no one totally told us how severe his COVID was. I think he had COVID pneumonia. And so it was at least moderately severe, but it didn't seem like he was ever admitted to an ICU, and his oxygen requirement wasn't long. So I'd probably throw him into the moderate end of things. And so 10 days. I think that was likely what his period of infectiousness was. Do you need to have tests to get out of isolation? No, not anymore. We do that in certain special cases where people have immunocompromising conditions underlying. We might help sort it out that way. But for the most part, mild to moderate infection, 10 days. And then you're done with isolation. Quarantine, however, is still 14 days, and that reflects the 4 days it takes to get symptoms, plus the 10 days in isolation, 14 days. The other thing is there have been a couple of reports about reinfection this week, including one here in the United States, and somebody who actually had a more severe infection the second time around. So first thing I'd like to tell you is that proving reinfection is hard. You have to have the virus from the first infection. You have to have the virus from the second infection, and then you have to sequence all of the RNA in them, and then find out if it's the same virus by using fingerprinting, molecular fingerprinting. So most of the time that first virus isn't available because labs don't hang on to it for more than a week or so. So reinfections are hard to prove. So a lot of times we talk about suspected reinfection, and in fact, many of the suspected reinfections actually are people who get infected and then, a month later have a resurgence of symptoms, and then you test them again and you find the virus again because people can shed it for a long time. And that's probably more a post-infectious inflammatory response, not unlike how you get mono, and then a month later you feel like you're feeling lousy again. And so some viral infections will do that. So in summary, I think reinfection is a really rare event. But not surprising, it happens with all viruses. And sometimes people's immune systems have a little bit of a hiccup and don't mount the response they're supposed to the second time around. Unfortunately, that's rare. So I'm not too concerned about the reports of reinfection. And then I walked in this morning, the sky still wasn't falling, so I think we're okay. What does that mean as far as vaccines go? That I'm still encouraged that vaccine immunity will be robust enough to make a big dent in our pandemic. Will it completely 100% prevent it in all individuals? No. But it'll if you think about it like flu vaccine, It'll reduce the severity of COVID, it'll reduce the number of our hospitalizations, and it'll shorten the duration of illness. That's my hope. And we'll have to see how the clinical trials go and see if that's borne out. Speaking of clinical trials with vaccine, another one was halted this week, Johnson & Johnson's adenovirus vaccine. And then Oxford, the Oxford Janssen vaccine trial that was halted about a month or a little bit more than a month ago across the world is now going on across the world, except here in the United States, where they're still reviewing how that one adverse event happened in that case. That was also an adenovirus vaccine. So now we have two adenovirus vectored vaccines that have been reviewed for safety data. So we'll have to keep an eye on that to make sure there's not something about vectoring a vaccine with an adenovirus. So you might ask, what does vectoring a vaccine with adenovirus mean? Well, what it is, you take adenovirus, which is a virus that causes cold and flu-like illness in humans, and it's been around for a long, long time, and then you attenuate it and beat it up so that it can't cause disease by itself, or you totally kill it, and then you put in the messenger RNA of, well, you don't totally kill it, but you make it so it can't replicate on its own. And then you put the messenger RNA of COVID in there, and then you give that vaccine, and then it replicates, that messenger RNA of COVID makes the protein, and we make an immune response to that. So that's one way of making a vaccine. And so we'll have to see how that goes. One other trial that was halted this week was an antibody cocktail trial. Monoclonal antibodies, this one by the company Lilly, which is different than the Regeneron cocktail that Trump got. And it was halted for unclear safety signal in a patient who might have had an adverse reaction that was considered serious. And there hasn't been a lot of transparency yet about that, what that is. At least I don't know. So we'll have to see how that pops out. One thing about that particular trial, that the amount of antibody that was being given, and this time to hospitalized patients, was pretty high. And sometimes people in hospitals have more unexpected events that may not be related to the drug just because they're in the hospital. But Regeneron's 2 antibody cocktail is being reviewed by the FDA now. And early preliminary data shows that if giving early in COVID, in the first couple days of infection, that it shortens the duration of symptoms, decreases the amount of virus that you can measure coming out of the respiratory tract, and may improve morbidity and mortality modestly. So that was the cocktail that Trump got. So we'll have to see what the final data shows, because it hasn't been published yet. And then we'll see what the FDA says about it all. So with that, unless anyone has any questions.
Dr. Olson,
yes?
Is it worrisome that these trials have been stopped, or is this normal in the case of doing all of this?
Is it worrisome that these trials have been stopped? No, not really. Having done clinical trials for almost 30 years now, either as a student or as a doc, now that happens. In fact, most of the time there's pauses put on them for a week or so until it's figured out. I mean, and it's just the best way to be safe. It's kind of like if you hear a noise in the middle of the night, it's worth getting up to go see what it is and investigate it, and then you can go back to bed and feel comfortable and safe again. And that's what happens with these trials. So it's not really worrisome nor unexpected. All right, well, last thing I would like to say, next week is Dr. Ohl's fall break. And so we're going to take a week off from our Thursday briefing, and I hope everyone has a safe fall through the next week. I think the weather's going to be wonderful, enjoy it. Remember, outside is better than inside when it comes to COVID. And then the week after that, I think, is the Thursday, will be the Thursday before Halloween. So we'll chat about that, and we'll chat again about Thanksgiving, because this is going to be a year for the small, intimate family Thanksgiving. So everyone think about that Norman Rockwell or Carver Knives painting of that small, intimate Thanksgiving around the dinner table with the turkey, rather than the large groups wandering about the house and watching football. So, all right, so see you in 2 weeks.